Good evening, everybody. Thank you for joining us. Tonight, we're going to be talking about how to build a TributeNight garment. My name is Kristin. I am a commercial training specialist here at L&R. At L&R, we're here to help you design something special. So first, who is L&R? Lohmann and Rocher, L&R, is a family-owned company based in Germany and Austria. So two family-owned companies merged, Lohmann Medical in Germany and Rauscher in Austria, becoming a leading international supplier of medical devices. We are a well-recognized and respected global manufacturer and supplier for over 170 years. In 2014, L&R acquired Solaris, a Wisconsin family-owned business who was founded by an OT. She started making garments in her basement with a sewing machine and bags of chipped foam. The Solaris collection from L&R features garments and wraps to support lymphedema and edema patients. We also supply bandaging and wound care products. Our North American headquarters is based in Milwaukee, Wisconsin, where many of our garments are made. And there's a picture there of our headquarters in Wisconsin. So let's talk about why do we use nighttime garments. First, we want to address fibrosis with nighttime garments. Nighttime garments help with fibrosis, provide gentle, continuous gradient compression to break down hardened tissue and stimulate lymphatic fluid flow. Want to increase compliance and promote independence. So bandaging for our patients at nighttime can be cumbersome, can limit their mobility, and can be very uncomfortable due to high containment, and it's very time consuming. Nighttime garments are designed to be easier and quicker to don and doff. They're more breathable and comfortable, offering mid-containment, unlike daytime garments that offer high containment, which can all improve compliance and therefore improve patient outcomes. Pressure differentials. By creating pressure differentials and a massaging effect with features such as foam, channeling, and or micro-massaging material, the garments help move stagnant lymphatic fluid out of the tissue and promote its reabsorption. Maintenance therapy. Nighttime garments prevent rebound swelling and maintain volume reduction. So if some patients do not bandage or wear a garment at night, they could refill while sleeping, preventing their ability to don their daytime garments when they wake up, limiting making their therapeutic gains. Nighttime garments can also help with further volume reduction. Under the Lymphedema Treatment Act, the LTA, Medicare patients are allowed 2 nighttime garments every 2 years. So one step further. Now we talked about why nighttime garments are used, but why custom nighttime garments? So first, unlimited style options. Ready to wear or off-the-shelf garments may not have the appropriate garment style for the patient's affected areas. With custom, we can create one-of-a-kind garments. Unique presentation or sizes. Every lymphedema case is unique in its own way, from the affected area to the various presentations in shape and size. A patient may fall outside of a sizing chart, and one size garment does not fit all. With custom, we can tailor garments exactly to a patient's presentation to improve outcomes, comfort, and compliance. Medically necessary modifications. Patients with limited mobility, range of motion, strength, and dexterity issues benefit from modifications which tailor the garment to their abilities. If the patient can't don the garment, they simply will not utilize it. If L&R looks at an individual's abilities and preferences. Again, under the Lymphedema Treatment Act, the LTA, modifications and custom garments are covered when deemed as medically necessary with appropriate clinical documentation. So custom garments give us the ability to look at a patient as an individual, understand their presentation, their limitations, abilities, preferences, all to maximize their quality of life and managing their lymphedema. So what is Tribute Night? Tribute Night is our line of custom evening and nighttime gradient compression garments. They're used in the maintenance phase of therapy for managing various stages of lymphedema and edema. These Tribute Night garments provide continuous mid-containment to maintain reduced volume and shape. They're comfortable, they offer a medium stretch material, and they're powered by CoolCore technology. So CoolCore is an innovative fabric with chemical-free cooling power. It's built into the fabric. It helps wick away sweat and moisture and keep you cool. Especially important if you're down in the south like I am. My OT trick I recommend is you can roll up these garments, put them in a bag, and put them in the fridge or freezer, and it feels very nice to don, especially on the hot summer southern day. Tribute Night garments are easy to care for. You can just throw it in the wash machine and dryer to launder. Tribute Night is the premier option for nighttime garments, not just because of the high quality materials we use, but the creators of these custom one-of-a-kind garments. To us at L&R, custom does not just mean creating a garment that doesn't fall within a size range or adding a modification or two. Our complimentary Custom Design Center is your partner in creating solutions to your therapeutic needs. We're here to help you, and here's how they can. So we're here to make your job easier. Pictured here on the right-hand side, the lower right-hand side of your slide, the 4 women on the right, from left to right. We have Deanne, the Director of Design, Deanne next to her, Emily, and Anna. Those 3 are our design consultants. The women on the left here, a bunch of the women who help create the garments, measuring and order support. So not only are L&R's Design Center a phone call or email away, but they're able to virtually assist you with measuring. For example, you can have the patient present and they will guide you on how to measure and how to fill out the order form. So they can do that with over a FaceTime, Zoom, any other media like that. They offer recommendations on fit, style, and modifications. So they help you and your patient build a custom personalized garment with unlimited options that you may have not thought of and that you didn't know that they could do. Considerations for all levels of patient presentation, mobility, and preference. So again, they're your partner in troubleshooting. They offer individualized solutions based on the patient and therapeutic goals. In addition, they can help you answer questions you may have on remakes, adjustments, tracking your garment, warranties, order history, and more. These ladies are located at the U.S. headquarters in Wisconsin, where all of our Tribute Night garments are created. So we're proud to be based in the United States. Here is our Design Center's contact information, available Monday through Friday, 8 through 5 p.m. Central Time. This is their phone number here and their email. And I'll just leave a minute here if you would like to write this down. All right, let's talk step by step on how to make a Tribute Night garment. Every lymphedema case is unique. Because of this, the best maintenance garments are customized to your patient's exact measurements and preferences. All right, let's get started. So first, we want to determine the garment style. To begin, identify where you would like the garment to cover. Then use our measuring form to indicate the length and circumference measurements where coverage is needed. You may need more than one order form, determining on the style you're looking to build. If you need help determining what measurements are needed for the style you're looking to achieve, Design Center can assist. So again, 100% customizable from head to toe. If you have a unique garment in mind, Design Center can certainly help. Here are some pictures of some Tribute Night garments. Every presentation is unique, but here are some of the possibilities that you could do. We have some head and neck garments, upper extremity garments, torso garments, and lower extremity garments pictured. Step 2, select the channeling type. So Tribute Night garments have deep channels sewn into the garment. They can be ordered in a diagonal chevron or straight vertical pattern. These are designed based on the MLD concepts of redirecting flow of lymphatic fluid. So chevron channeling, that vertical channeling, is used to direct fluid to collateral pathways, appropriate for those with secondary lymphedema. So oftentimes we'll be utilizing chevron channeling. Vertical channeling directs fluid to intact lymph nodes for those with primary lymphedema. If you need help determining which style to use for your garment, you can contact Design Center. Step 3, select fill type and profile height. So this is an exciting slide because we are offering a new material, and we'll get into that. So our original chop foam, which if you know Tribute Night products, you probably know this. Our original chop foam consists of high and low density pieces and irregular shapes to help create pressure differentials. The foam nestles into the tissue to soften fibrotic tissue or harden skin. The foam technology is offered in 2 different profile heights, original and low profile. So the low profile, there's a picture here on the slide on the left-hand side. Low profile offers a more slimming, less bulky garment with just more narrow channeling. Our new Tribute Night style on the right-hand side is soft fill. So this is an alternate way to stimulate superficial tissue while at rest, just like chop foam. The main difference is the textured interior, pictured here in pink, which offers a micro-massaging effect, while the exterior is soft and smooth. It offers more flexibility, which is great for patients with strength and dexterity limitations. Your local representative can supply you with a sample of this material. The chop foam has the experience and is the champion in treating fibrotic tissue, years and years of success. But we have seen fantastic outcomes since adopting soft fill to our line. Patients enjoy the comfort and ease of donning soft fill garments, resulting in increased compliance. So choosing a fill, just like profile height, is based on you and your patient's preference. The original and low profile is only offered in chopped foam garments. Here are pictures of the effects of chopped foam garment and a soft fill Tribute Night garment. On the left here, this is after the patient doffed a lower extremity chopped foam Tribute Night garment. On the right, you have the effects of a soft fill Tribute Night garment after the patient doffed it. As you can see, there's almost a linear pattern. A micro-massaging type effect helps stimulates that superficial tissue. Again, both stimulate superficial tissue. They're just 2 different options of how to do that. Step 4, probably the easiest part. Well, maybe for you. Your patient might think otherwise because we have some great colors. Black, blue, raspberry, slate, and purple are all options for your TributeNight garment, whether it be soft fill or chopped foam. If you are getting a Velcro accessory placed on the garment, your garment will have to be black because that is our Velcro receptive material. Step 5, a step that's optional, add modifications. For some TributeNight styles, certain modifications have default positions. So with the help of Design Center, these default positions can be customized. First, adjustable straps with finger grips. These are Velcro straps. And also adjustable panels, adjustable Velcro panels. They're used for contouring, providing compression relief for sensitive areas, accommodate for a girth fluctuation, and targeting compression for localized swelling. For example, you might address fluid pooling around the malleolus with Velcro straps. There is no default position, so you can indicate on the order form where you would like them placed. So on the left are adjustable Velcro straps with finger grips. As you see, there's a little cutout circle. That's great for those with dexterity issues. These straps are available in narrow and wide. Depending on the body part, our design center might use their best judgment in determining if narrow or wide straps should be used, or they may contact you to answer any questions that they might have. On the right, adjustable Velcro panels. These are offered in 10-centimeter panels. The exterior garment fabric is Velcro receptive and available in black only. These panels help aid in donning. Here are some more modifications. Pull-up loops. Pull-up loops assist patients with limitations in reach or trunk flexion. On the right, pictured here is a zipper. We recommend a zipper for clients that tug and pull consistently. Zippers allows easy access, decreases pulling on garment during donning. For example, zippers may improve ease with managing a garment during toileting and could be placed on either side of the waist in addition to a front zipper. All zippers are back set to protect your patient's skin. These modifications are beneficial for patients with limited strength or range of motion as well. More modifications, non-skid pads. Those provide traction for mobility safety, prevents slipping if your patient gets up out of bed to use the bathroom, and also reduces pressure points caused by the garment shifting. Digit spacers address finger swelling and prevent distal backfill. They can be placed beginning at the fingertips or the DIPs. Snap tape is simply used to connect garments together. So again, Design Center can help with customized solutions for unique modification placement based on the individual. Modifications are not limited to what you see on the order form. That's why we encourage collaboration with our design team. We understand every patient lives a different life and has their own set of needs and preferences. Step 6, add optional accessories. So TributeNight garments can be paired with optional accessories to enhance your patient's garment experience. These accessories are designed to provide better containment, protect the garment from external elements, or simply support easy donning. Pictured here is our variable compression jacket, also known as the VCJ. The variable compression jacket is a low stretch material that offers extra support and high containment. It provides adjustability with Velcro fasteners and offers easy donning and doffing with an additional zipper. So VCJ delivers high level of containment, mimicking short stretch containment, and can even provide reduction. So a VCJ slides over a TributeNight garment. You set the adjustable straps to the desired containment, and then you just zip it up. While TributeNight is designed to maintain volume reduction on its own without any bandaging or cover needed on top, many patients can benefit from the added containment offered by adding a variable compression jacket. Another optional accessory is our outer jacket, or OJ. It's just a sleeve that goes over the TributeNight garment, and it protects your TributeNight garment from dirt, pet hair, stains. It also helps the garment slide better in bed. It adds additional minimal containment. It's really designed to protect your TributeNight garment. It feels smooth and silky. We offer this in black, blue, raspberry, slate, and purple, just like the TributeNight garments itself. It adheres to the garment with either a Velcro or snap fastener. Lastly, we have an easy slide donning aid. This addresses immobility and donning, doffing due to dexterity, range of motion, and strength limitations. Now let's put it all together and take a look at the TributeNight order form. Here is an example of a TributeNight arm order form. So first thing, like we mentioned, we want to determine the garment style. You may have to use more than one order form depending on the style garment you're creating. Where there's a blank there, you want to put from the measurements that you want the garment to cover. Step 2, select the channeling type. So again, we're looking at the arm order form. You will likely utilize the chevron channeling. If you do need to use the vertical channeling, a design consult is needed and they will contact you. Select fill type and profile height. So this is where we get to choose between the original chopped foam or the new soft fill. And the profile is original or low, and those can either can be options for the chopped foam fill. The soft fill is standard. We want to pick the fabric color, add optional modifications. I highly encourage to always write notes under the notes and placement instruction where you want the zippers. Again, some of these modifications have default placements, some do not, so always indicate in the instructions. And we will do a separate webinar too about talking about default modifications and such. But again, always specify, and don't forget the quantity as well. This is where we can choose from a variable compression jacket, an outer jacket, an easy slide donning aid. I highly encourage that every TributeNight garment does get an outer jacket to protect it. And then again, the variable compression jacket, a lot of people can benefit from. And on the right-hand side of the order form is where you will record your measurements. Again, we will do more webinars and we will include how to measure. That will be a more in-depth webinar. And again, there's a TributeNight arm order form. You can see the Design Center's contact information are all on the order forms in the upper right-hand corner. We have a lower torso and leg order form, a head and neck order form, an arm, a hand, which are right and left specific, and torso order forms. At L&R, we offer very generous warranties on our TributeNight garments. The three we'll talk about here. The first fit guarantee, within the first 45 days, L&R will alter or remake your patient's garment as many times as needed to ensure we get the perfect fit. We want our patients to be happy and compliant with their garments. The reduction alteration warranty. So with patient compliance, we are hopeful that they will reduce in size when wearing their garment. If the patient reduces within the first year, we will alter that garment to reduce the size. You can send the garment back with new measurements, marking it with a fabric marker or clipping the garment with clothespins to send it back. So essentially, it's like getting a whole new garment. And again, a patient is eligible for this within the first year. And then TributeNight garments have a 1-year manufacturer's warranty. So stay tuned for more webinars. We will include further webinars on TributeNight, Tribute Freedom, our newest custom daytime line, measuring, unique design solutions, and so more about the Solaris collection. We're very excited to help educate you and equip you with knowledge. We are here to make your job easier. We're your partner in custom design, among other things. So please reach out to your local representative. They can get you samples of this new soft fill material. They can certainly get you samples of a standard chopped foam TributeNight garment. You can reach out to me directly, and of course, Design Center, who is there to help you design the perfect custom garment for your patient. No patient is too difficult or challenging for our Design Center. What questions do we have?